Mepilex Up's high conformability and low profile make it ideal for difficult-to-dress areas often seen in diabetic foot ulcers. It can be cut and shaped to fit different wound shapes and locations, offering flexibility where it's most needed. It manages exudate from low to highly exuding wounds and can also absorb viscous fluids. The SafeTack layer gently adheres to surrounding skin while sealing the wound edges, ensuring secure placement and minimizes the risk of maceration. Start by cleansing the wound in accordance with clinical practice. Dry the skin surrounding the wound thoroughly. Remove the first release film and apply the adherent side to the wound. Remove the remaining release film and smooth down the dressing on the skin. Do not stretch the dressing. Secure the dressing with appropriate fixation and/or compression. To learn more, visit us at mepilex.com.